Hey everyone, and welcome back to our channel. Today, we're tackling a serious but important topic: tuberculosis, or TB. It's an ancient disease, but it's still very much a part of our world. So, what exactly is it? Tuberculosis is a contagious infection caused by a bacterium called Mycobacterium tuberculosis. While it's most famous for affecting the lungs, it can actually attack other parts of the body too, like the kidneys, spine, and even the brain. Understanding TB is the first step towards protecting ourselves and our communities. So, how does someone get TB? It's an airborne disease. When a person with active TB in their lungs coughs, sneezes, speaks, or even sings, they release tiny droplets containing the bacteria into the air. If another person breathes in these droplets, they can become infected. It's important to know that you can't get TB from shaking hands, sharing food, or touching bed linens. It requires close and prolonged contact with an infectious person. Now, let's talk about the two main stages of TB: latent TB and active TB. A person with latent TB has the bacteria in their body, but their immune system is keeping it under control. They don't feel sick, they have no symptoms, and most importantly, they cannot spread the disease to others. Many people with latent TB never develop active disease. Active TB, on the other hand, is when the bacteria become active and multiply. This is when a person feels sick, shows symptoms, and can be contagious. The transition from latent to active can happen when the immune system gets weaker. This brings us to prevention. How can we stop the spread? One of the most common methods globally is the BCG vaccine, often given to infants in countries where TB is prevalent. But vaccination isn't the only tool. Early detection and treatment of active cases are crucial to break the chain of transmission. Simple measures also help, like ensuring good ventilation in indoor spaces to disperse any airborne bacteria, and practicing good hygiene, like covering your mouth and nose when you cough or sneeze. So, how do you know if you might have active TB? The symptoms can be tricky because they can seem like other illnesses. A persistent cough lasting 3 weeks or more is a classic sign. Other symptoms include chest pain, coughing up blood or phlegm, weakness, fatigue, weight loss, fever, and night sweats. If you're experiencing these, it's really important to see a doctor. Diagnosis often involves a few steps. Doctors might use a rapid molecular test like GunExpert, which can detect the bacteria and check for drug resistance quickly. A chest X-ray can also be used to look for changes in the lungs. The good news is that TB is treatable and curable. The standard treatment for active TB is a course of several antibiotic medications that must be taken for about 6 months. It is absolutely critical to complete the entire course of medicine, exactly as prescribed by your doctor. If you stop treatment early, even if you start to feel better, the bacteria can survive and become resistant to the drugs. This leads to drug-resistant TB, which is much harder and more expensive to treat, requiring longer treatment with more side effects. It's a serious threat. So adherence to the full treatment plan is non-negotiable for a successful cure and to prevent further spread. To wrap things up, while tuberculosis is a serious global health issue, it is not a death sentence. It's a preventable and curable disease. With awareness of how it spreads, recognition of the symptoms, prompt diagnosis, and most importantly, completing the full course of treatment, we can manage it effectively. By understanding TB, we can work together to fight stigma, support those affected, and move towards a world free of this disease. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe for more health content. Stay safe and informed.